Good afternoon. I'd like to call the meeting to order of the Northern Nevada Public Health at 1:05. I'd like to go ahead and call for the roll, Madam Clerk.
Vice Chair Andriola.
Present.
Board Member Anderson is trying to attend online. Board Member Brown.
Here.
Dr. Danko is absent. Board Member Driscoll.
Here.
And Dr. Duarte.
Present.
Okay. We do have a quorum. We are waiting for one person to attend via phone.
Thank you. I'd like to just quickly thank everybody for a 5-minute delay, but and we'll go ahead and you'll let us know when Member Anderson arrives.
Yes.
Thank you. I'd like to ask Dr. Duarte to do the Pledge of Allegiance, please.
Recording in progress.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll go ahead and move to the approval for the item number 3 for approval of the agenda. May I?
Make a motion to approve.
Mr. Brown has the motion, and I see a second by Mr. Driscoll. All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Okay, we'll move now, if I could, and I hope it's okay. Can we move the public comment, if we could? I just approved the agenda, so I'm just used to the public comment always going before any business starts, so if you want us to follow, I'll defer to legal counsel.
There are two methods by which public comment occurs, and generally, I'd have to take a minute to look, and so I'm not entirely prepared to ask that
Okay.
question. For purposes of the way our agenda is set up, because comment is taken after action items, the general public comment is movable within the agenda. It's not required to be at the start before business items. So I do believe you have the discretion to move that if you wanted to. The rationale for its placement where it is on this particular agenda is to accommodate staff who are here for recognitions and proclamations so that they may return to their duties before the public speaks for efficiency. But I do believe it's in your discretion to move.
No, I appreciate it. We'll go ahead and stay with it the way it is, given the fact that we are being cognizant of staff time. But I also can now, you all can understand I'm a creature of habit, right? So that's all that happened right there. But we'll go ahead and move to item number 4, which is recognition.
Thank you. Managing and just trying to manage a few technical challenges. We're going to begin with recognitions. We'll first invite new hires down, and I believe Dr. Dow will be introducing our new member.
I don't think
Yeah.
the mic's working. Well, I mean, I think it's working.
It's working. Just push the button again. There we go.
There we go. I think that's it.
Is that better?
That's
Yes.
perfect.
Okay.
Thank you.
All right. For the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. I'm pleased to introduce to you Ms. Leah Lagman here with me, who is currently a public health investigator under our epidemiology program. Ms. Lagman began her public health career after graduating from the University of Nevada, Reno, with a degree in public health and a minor in addiction treatment services. Prior to joining NMPH, she has spent 3 years working at the State of Nevada's Office of State Epidemiology, where she focused on communicable disease investigations for rural counties in Nevada. Ms. Lagman is very passionate about public health and is dedicated to promoting safe practices within our communities to help prevent the spread of disease. Outside of work, she enjoys spending time with family and friends and exploring new places through travel and spending quality time with her dog. And she's very festive and loves baking and decorating for all holidays and loves all kinds of art. We're very fortunate to have her on our team, so welcome again, Leah.
Thank you so much. And I love your hobby of practicing any type of culinary skills. And if you need anybody to test anything, I will be happy to oblige. But anyway, thank you so much and welcome.
Thank you. Nice to meet you all.
Next, we have recognition of years of service, and Aaron Dixon will be presenting those.
Good afternoon. I have the honor of highlighting our 2 staff members with years of service. Our first one is Brenda Rambosek. She is in our environmental health division. She is an environmental health specialist with 25 years of experience. Very exciting. She's one of our most experienced inspectors and does a great job, especially with training some of our new hires. So very glad she's on our team. And then second is Alejandra Rosales Garcia. She is in Community and Clinical Health Services. She is a clinical assistant with our family planning program, and she has also been with our WIC program. So thank you.
Thank you.
Next, we are going to invite Lisa Schertz up to introduce. We're inviting Lisa Schertz up to introduce this month's Health Heroes. Thank you.
Good afternoon. For the record, I'm Lisa Schertz, a health educator with Community and Clinical Health Services. And our Health Heroes Employee Recognition Program, in February, Jim English was recognized for collaboration and inclusivity, and he works in environmental health services. And then Lisa Lotritz was recognized for all 5 values: adaptability, collaboration, compassion, inclusivity, trustworthiness. And Lisa is the division head in Community and Clinical Health Services. And then from Air Quality Management, we have quite a team. All recognized for all 5 values: adaptability, collaboration, compassion, inclusivity, and trustworthiness. Candace Brown, Brandon Koyama, Nico Mastic, Matthew McCarthy, Brendan Schneider, Jeff Jepson, Janine Rosa, Josh Ristori, Craig Peterson, and Francisco Vega. Thank you.
Thank you. Well, what a great group. Thanks and congratulations to all. Welcome to those that are, not only Ms. Lagman as a new hire, but everyone who does great work here, so appreciate it. We'll now move to item number 5, which is a proclamation for recognizing National Public Health Week, April 7th through the 13th.
Good afternoon. Erin Dixon again. It is my honor to bring this proclamation forward. I apologize, I can't remember, am I to read it this time?
Sure.
Okay. All right, well, whereas the week of April 7th, 2025 is National Public Health Week, and the theme is It Starts Here, highlighting the importance of making a difference in our home, community, and state. And whereas this is the 30th anniversary of celebrating National Public Health Week, and in the past 30 years, significant strides have been made in public health, including deaths due to HIV and AIDS have dropped significantly, ensuring most people with HIV can live normal lifespans, and prevention tools significantly reduce transmission. Smoking rates have fallen due to comprehensive smoke-free policies, public awareness campaigns, and taxation of tobacco products. Childhood mortality has fallen due to vaccines, better healthcare access, and nutrition. Wintertime particulate pollution continues to improve to successful programs such as the Burn Code and local regulations governing wood-burning devices. Environmental health has improved the health and well-being throughout the region with food inspections, hotel inspections, school inspections, and education. Public health emergency preparedness has grown and responded to a global pandemic and local emergencies such as the Davis Creek Fire. Pandemic preparedness has now grown. Breakthroughs in vaccine technology, genomic epidemiology, global health initiatives have improved disease control, leading also to improved treatments and stronger surveillance systems to combat emerging infectious threats. And whereas a person's health status can differ drastically by zip code due to differences in the built environment, environmental quality, community context, access to healthy foods, access to education, and access to health care. And whereas public health professionals help communities prepare for, withstand, and recover from the impact of a full range of health threats, ranging from infectious disease outbreaks to natural disaster preparedness. And whereas efforts to adequately support public health and the prevention of disease and injury can continue to transform a health system focused on treating illness into one focused on preventing disease and injury and promoting wellness. Now, therefore, be it resolved that Northern Nevada Public Health District Board of Health does hereby recognize the week of April 7th through the 13th, 2025 as National Public Health Week. Thank you.
Thank you. And thanks to the entire team that makes that happen. So big round of applause to everybody. Thank you. Well, it's going to be time for public comment. So do we have any public comment?
We'd like
And
to
do you have
note
to read
that
a statement?
Mr. Anderson joined
Oh,
at
yay.
1:10.
Great.
Okay. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. We have no public comment in the room, and there are no Zoom users logged in requesting public comment.
Thank you.
We still have quorum with Anderson on. You're good.
Yeah.
Okay.
Great, thanks. So we're going to move to item 7, which is the consent items. Does anyone have any item they'd like pulled? Mr. Anderson, just to make sure you can hear us and we can hear you, do you have any item that you'd like to have pulled? Can you hear us?
I did get notification he's not hearing anything. Are you showing that he is online?
Okay. Well, can he respond somehow to you? So he just responded that he can't hear anything. I don't know what the legal thing, can you text him and ask him if he has anything he'd like pulled? I don't know if that's a legally compliant action, but given that Mr. Huarte just walked out of the room, I just want to ensure that we have a quorum and everyone's hearing everything appropriately.
Thank you. We do need that quorum. There should be a chat feature on the Zoom, potentially, that he can be reached by, but if not, you can contact him.
Okay.
We are in a hold until we know if we have a quorum.
Thank you. Thank you.
Thank you.
Is this where the music plays?
Yeah.
Xylophone.
Or, Mr. Driscoll, would you like to sing for us all, or? Not a good idea, Mr. Brown? That might get Mr. Anderson to quickly get online.
He just dropped off, so I'm trying to
Okay.
contact him to get him back on.
And I'm definitely not volunteering. Dr. Kinsley, would you like to hum a few bars?
No,
Okay.
you do not want to
Any
hear
from
me.
the audience want to hum? I feel like we should do the Jeopardy dun, 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 dun. I'm definitely not as witty as Alec Turetti, and now with Jen Kenning's like, no match.
No, you're right.
No, it's just.
Recording in progress.
Well, now we'll have a quorum.
Yeah, quorum.
When Mr. Arte walks in, yeah. Ms. Reed, given that Mr. Wate is back with us, I believe we have a quorum. If it's okay, we'd like to proceed.
Absolutely, thank
Okay,
you.
thank you. And then we'll certainly appreciate Mr. Anderson joining us when that all works out. So we're still on item 7, and I'm just asking if anybody has any items that they'd like to pull. Hearing none, I'd go ahead and like to request that a motion be made to approve as presented. Mr. Driscoll made the motion. Do we have a second? Mr. Brown has second. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Okay. See, I shouldn't have been singing and paying attention. We'll now move to item 8, which is technically a public hearing, so I'll open up the public hearing. And Dr. Kingsley, would you like us to open it up? I know Mr. Peterson looks like he's coming down to present the information.
Thank you very much. This is a public hearing for review and discuss and possibly adopt the proposed revisions of District Board of Health regulations governing air quality management, Chapter 040, and we'll turn it over to Mr. Peterson at this time. Thank you.
Just for the record, Mr. Anderson is back on.
Thank you.
All right. Good afternoon, Vice Chair Andriola and members of the board. My name is Craig Peterson, and I am the Monitoring and Planning Supervisor for the Air Quality Management Division. Today serves as the public hearing for the adoption of our proposed asbestos regulation revisions. This presentation is basically the same as what I presented to you last month for the business impact statement presentation, so I can move through it a little bit quicker. All right, so again, here's our new mission statement. And here are the elements of the strategic plan supported by these rule revisions. A reminder of why we needed to revise the asbestos regulations. So on September 16th, 2024, the District Board of Health adopted revisions to our general source permitting regulations, Chapter 030. The sections in Chapter 030 pertaining to asbestos were removed and are being relocated to Chapter 040, prohibited emissions. These sections pertaining to asbestos have not been reviewed or revised in 25 to 30 years and do not reflect our current asbestos acknowledgement process or intended purpose of the federal regulation. Some of the major changes include separating the rules into 2 parts, asbestos control standards and acknowledgement of asbestos assessment. Each of the 2 parts have definitions added to increase clarity. We also added specific record-keeping requirements and a clear list of exemptions and exceptions. And finally, the structure of information is simply more organized. In general, Part 110 provides additional clarity to the federal requirements for asbestos, and Part 115 provides additional clarity to the local requirements associated with renovation and demolition projects. Part 110 establishes standard work practices, clarifies requirements for alternative work plans, and includes survey, notification, and disposal requirements. This part of the regulation closely mirrors the asbestos national emission standards for hazardous air pollutants, or asbestos NESHAP. Part 115 identifies when an acknowledgement is required. It also defines the quantity of disturbance limits and the documents that are required for a complete application. These are our local requirements of a process that is not really changing, just being documented in a clear regulation. So, community and stakeholder engagement included consultation with the AGC in Nevada, holding a public workshop, including 2 press releases, and posting the proposed rule revisions to the air quality website. We also sent the proposed revisions to the Air Quality Management Division email subscription list and to our asbestos stakeholder email list. All comments received were responded to and incorporated in the new revised regulations. Today's public hearing was noticed in the Reno Gazette-Journal with 3 legal ads per NRS requirements, and those are the publishing dates on the screen. I went over the business impact summary last month, but the bottom line is the proposed revisions are intended to satisfy federal EPA requirements, streamline acknowledgement expectations for the regulated community, and do not include provisions that are more stringent than current federal, state, or local standards. Here's a review of the revision timeline. The public comment periods beginning October 14th and January 14th are complete. The business impact statement was adopted on February 27th, and today is the public hearing for board adoption of the proposed regulation revisions. And that's all I have for today, unless there's questions or comments. And if not, the next slide is a motion to adopt the proposed revisions.
There we go. Thank you, Mr. Peterson.
You're welcome.
Before we call for public comment, does any of the members have any questions? Mr. Anderson, can you hear us?
Yes, ma'am.
Hello.
Thank you. Took a while, but we're here.
Hey, well, welcome. Do you have any questions for Mr. Peterson?
No, ma'am.
Thank you. Do we have any public comment?
No public comment.
Okay, hearing no public comment and no questions, I go ahead and entertain a motion.
Move to adopt the proposed revisions to the District Board of Health Regulations governing air quality management, Chapter 040, Part 040110, Part 040115, with the implementation date of the 27th of March, 2025.
Thank you, Mr. Brown. Do we have a second?
Second.
Uh-oh. Go ahead, Dr. Huarte. We have a second. All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you, Mr. Peterson. I'll go ahead and close the public hearing for item number 8.
Thank you very much.
Thank you. I'll go ahead and move then to item 9, to recommend upholding the decision of the Sewage, Wastewater, and Sanitation Hearing Board to approve variance case number H25-0001 VAR-I of the Northern Nevada Public Health Regulations governing SWS, allowing a variance for multiple sections of regulation, including a reduced setback to groundwater and impervious soils mitigated through the use of an advanced treatment system for Taylor Benedict, owner of 17590 East Aspen Circle, Washoe County, Nevada, assessors parcel number 087-044-17. And Mr. Kelly is there. Thank you.
Maybe I'm here. Am I here? Okay. For the record, my name is David Kelly. I'm a supervisor with Environmental Health Services. Apologize for the long lead into this. I'm going to try to give you the real 30,000-foot view, and then you guys can ask questions. It is an advanced treatment. It's something that we don't see a lot of, so we'll proceed from there. So the variance before you is primarily caused by challenging site conditions. There are site conditions which make safe placement of septic systems hard, and we're running into that more and more frequently these days as buildable lots become smaller. We deal with a lot of fractured rock, slow soils, high groundwater, things of that nature. That, combined with the limited advanced treatment options allowed by the regulations and the scarcity of the resources needed to have those, customers are beginning to look more and more towards alternative systems so they don't have hauling of the sand and other issues. Fortunately, the septic industry has created some systems that will allow for that. NSF certification 245 is a standard that's specific to residential septic systems, and specifically is a standard that has to do with the reduction in nitrogen. Nitrogen is one of the primary concerns for public health and groundwater contamination with septic systems. These systems that have this certification, when properly function, can be expected actually to clean the effluent to a greater degree than the currently regulatory allowed systems, and the variance before you does propose a system that has that certification. So despite the fact that they can produce cleaner effluent, the regulations do not allow for them without a variance, so that's why we came through the variance process. We do intend to bring these into the regulation in the future so that we don't have to go through this process. In the past, concerns with these types of systems primarily lie with the fact that they require active maintenance from licensed people who understand them. The systems that are currently allowed are passive, right? They just exist, they function, and they can be expected to clean without any interaction. These need some additional help. With that in mind, when we went through the variance process, staff made some specific recommendations to help mitigate those concerns, and the Swiss Board also added some additional conditions as well. So we feel that the package of conditions with this should provide mitigation for those concerns, and we are supportive. We are going to continue to deal with properties that have these challenges. This is an industry-based solution that we're going to continue to want to have, and we're going to want to incorporate in our regulations. And so we know this is it's not the first, but it's one of the first that we're going to have. We're going to have more of them, and so we are supportive of this. If you're interested in the conditions, I'm happy to list them or answer any other questions you might have.
Thank you. Is there a request to go into any of the additional conditions or any of the additional information? Mr. Anderson, just making sure you're here.
I'm still here. No questions for me. Thank you.
Okay, thank you. I'd like to go ahead and call for public comment.
I have no public comment requests.
Okay, hearing no public comment and hearing there aren't any additional questions, I'd go ahead and ask if we could have a motion considered. Mr. Driscoll.
I would move to uphold the decision of the SWS Board to approve variance number H250001 VARI with no additional conditions.
Thank you, Mr. Driscoll. May I have a second?
Second.
Mr. Brown, I have a motion by Driscoll and a second by Member Brown. All those in favor signify by saying aye.
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 Any opposed? Motion carries unanimously. Thank you, Mr. Kelly. We'll move now to item number 10, discussion and possible acceptance of the ERG organizational audit of Air Quality Management Division and possible direction from the Board of Health. Mr. Vega, thank you.
How about now? There we go.
Yes. That sounds like a commercial.
Yeah.
Sorry.
Thank you, Vice Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Before I turn it over to ERG to provide their presentation, just want to thank a few groups and individuals. First, I'd like to thank the board. Without your support and direction, this assessment would not have taken place, obviously supplying the financial resources as well. So again, just want to really thank the board for that leadership. Stakeholders, we had external stakeholders that participated in the assessment, so just want to thank them for their time and effort in making this a really good process. Next, staff. again, their cooperation and willingness to be honest and transparent throughout the process is really made this a really valuable assessment and provides a kind of a clear assessment of the current state of our organization. So thank you to staff. And then lastly, ERG. They did a tremendous job throughout this entire process. So really happy with the final product. And again, without their services, we wouldn't be here. So wanted to thank all those individuals and groups. And with that, I'll turn it over to ERG.
Thank you.
Yep.
Okay, thank you, Francisco, and thank you to members of the board. We are appreciative of this opportunity to make this presentation. We've got a fairly short presentation it's high level. It's covering some of the high points of our audit report, which was completed last month. Let me get that up for us so we can look at our presentation. And please let me know if you can see it okay.
We can see it.
Okay, thank you. Again, like to do some quick introductions. My name is Marty Wolf. I am the project manager of the audit project. I'd like to introduce the other members of our team. Matt Haber, who is our other presenter today. He was focused on the permitting aspect of the work. Dan Roper is here with us today. He was doing the compliance portion of the work. He is not presenting, but he will be available to take questions if needed. Stephanie Popolars provided help on our interviews, and with our permit review, she is attending as a member of the general public and not as a panelist, but she's taking some notes for us. And then finally, Jennifer Lamb led our interviews. She had a conflict today and was unable to make it. So again, thanks to Francisco, the staff of AQMD, particularly the steering committee, for enabling us to conduct this work. Like to move on to a quick agenda. We'll talk about purpose and methods, and then we'll just give, again, a high-level snapshot of our key findings. I will be covering the general operations and business practices. Then Matt will switch over and cover permitting and compliance. Then we'll talk about some high-level conclusions and some of our recommendations. And then we will be available to take some questions. Again, this is a high-level presentation. There's more details in our audit report, which we published or submitted to AQMD back in mid-February. So to begin with, what is the purpose of this organizational audit? And there were three main areas that we focused on. First of all, understanding the strengths, weaknesses, and challenges for AQMD related to permitting, compliance, and then also transparency in their operations and how well they respond to the community. And then finally, overall operational efficiencies and business practices. Identify areas for improvement. And then finally, develop some recommendations to help AQMD with both their inward and outward delivery of their services. Now, we took a multifaceted approach. I'd previously mentioned the steering committee. We met with them on a monthly basis. I believe it was the last Wednesday of every month, and spent some time talking. Depending on the needs, we met more or less frequently, but again, we appreciate their help and guidance and direction. And then from there, we did a document review. As mentioned, we also interviewed 12 different people, 10 people within AQMD, and then 2 of the external customers. Related to environmental justice, we did a desk review of existing best practices. We did a permit review of 14 permits that were held or that are maintained by AQMD. And then finally, we did a compliance review of 12 sites. And Dan Roper came out and for a week and tailed or went along with some of your inspectors and reviewed the compliance processes. And throughout each of these methods that we did, we were keeping in mind these key audit questions. Number one, is AQMD meeting and delivering on the community needs? Number two, is AQMD utilizing best business and operating practices? Number three, is AQMD identifying and addressing areas for operational improvement? And number four, are there changes to processes and procedures that could improve important outcomes of AQMD's work? And again, we kept those in mind throughout the months that we were working on this project. Okay, first of all, digging in a little more specifically as we conducted our interviews, we looked at, again, strengths, challenges, and areas of improvement. And one caveat that we'd like to present, and I believe it was included as a footnote on the previous slide, is that in some instances, the perceptions varied depending on who we interviewed. Sometimes there were slight differences in what AQMD management believed or thought versus what AQMD staff believed or thought. And so, again, those come down to perception, interpretation, and we did not necessarily make a judgment as to which one was correct or incorrect. But with that in mind, we did, through the interviews, identify that there are some definite strengths related to effective external communication. There's good teamwork within the agency, and that they are very efficient with their resources that they have. Identified challenges related to staffing turnover. And as you may know, staff turnover tends to result in a loss of institutional or individual knowledge. There are also challenges related to unclear roles, which can cause challenges related to accountability. Another challenge was the lack of technical advances, in particular software used in the AQMD processes rather than paperwork. And then a couple more there going towards the bottom, operational restrictions. And in particular, we identified challenges related to AQMD being housed within NNPH. That was identified as a challenge. And then moving to areas of improvement, again, addressing some of these challenges, trying to strengthen some of the capacity and the resources, and then increase the transparency and outreach support, and then be consistent in the regulatory efforts. Moving on to some of, again, continuing on with the interview perceptions as well as our desk review, we looked at the community opportunities and environmental justice. And some of the opportunities of increasing public awareness and outreach, focusing on increased workshops in order to interact with the public, more technical assistance, which might mean increased office hours and things of that sort. Moving on to the best practices, identifying and clarifying the environmental justice concerns, and then incorporating the EJ principles in the decision making and then getting those concerns engaged early on in the planning process. And then similarly, as we mentioned earlier, using tools and technology to bring that into play with the environmental justice requirements. And with that, I'm going to switch over to Matt for the next couple of slides. Go ahead, Matt.
Great, thanks, Marty. So we did conduct interviews of the stakeholders, which included staff and outside stakeholders with respect to permitting, but those were really covered in Marty's discussion about business practices. So when we talk about permitting and enforcement, we're really talking about ERG's subject matters experts' perception. So one thing that, again, strengths, challenges, and areas for improvement, AQMD had already started on an internal improvement process before we were engaged. So there are some things that we're recommending, and there are some things that we saw as challenges, but they are things that AQMD is already doing, and we're basically saying, do more of that. So some of the strengths we saw were good consistency throughout the permitting process, the federal requirements, which form the foundation for what AQMD needs to do, are referenced clearly and accurately in the permitting documents, and templates, which are a very helpful way to streamline the process, to reduce workload, and make things more simple for both staff and the regulated community. Where they're used are effective, and I'll cover templates again in a minute. We saw a few areas of challenges, which included some missed opportunities for emission controls. And here, one example is that we found there are some kinds of facilities that produce emissions in a way that if they aren't captured, they can't be controlled. So we noted in these of the 14 permits that we reviewed, there were, I think, 5 permits that were sources of that type, and being more effective to make sure that all the emissions are captured as well as controlled is a way to ensure more effective opportunities for emission controls. Some permits had inconsistent content from one permit to another where the sources might be similar, and especially with older permits, the supporting documents weren't very consistent. And AQMD has definitely moved in the direction of ensuring that the supporting documents are much more consistent and informative. In terms of area for improvement, we're suggesting that AQMD be very specific to the source because every source is a little bit different. Further develop templates to improve and streamline the permitting process, and update permitting language in a way that I'll talk about in a couple of slides. Next slide, please. With respect to compliance, again, this is our subject matters experts' perceptions. And just as a quick reminder, this was both a desk audit and based on field observations, going out and joining the department's inspectors. So strengths, consistent and professional inspections, and a really good thing that there are some technologies that are very helpful to help determine whether a source is in compliance or not, and some of those technologies are in use. We thought that was very helpful, and that training opportunities are provided to staff. Some of the challenges include unclear enforcement criteria in standard operating procedures, so we think those should be clarified. And a link back to the permits that I discussed earlier. Sometimes this is a place where permits are ground truthed. So making that link back to permits and saying, well, we can't enforce this permit because of the way it's written, and closing that loop would be very helpful. Penalties are sometimes not well defined and generally are quite low compared with what we think they perhaps ought to be. Compliance assistant resources are important, but they're not collected together in a way that anybody who's looking for them can easily find them. And similarly, compliance data could be more transparent. So our recommended areas for improvement are clarifying enforcement criteria, improving feedback to inspectors as sources go through the enforcement process, close the loop using inspections to verify the basis of error permits, implementing a more robust civil penalty policy, enhancing the visibility of compliance assistance resources, and then increasing compliance data transparency. Next slide, I think back to you, Marty.
Yes, it is back to me. Thanks, Matt. with that, we're going to move to some of the conclusions. And again, these are kind of high level. And as I mentioned back several slides, these were the 4 main questions, key audit questions that we, again, kept in mind throughout the process. And Matt alluded to it. We noted in all of the areas that AQMD has had some positive strides given the current capacity and resources, but there are also opportunities for making further progress in these areas. So definitely a work in progress, but we're seeing positive, they're moving in a positive direction. And so it was encouraging in that respect. Some specific recommendations for general operations. We would encourage AQMD to clarify the staff roles and the expectations, and then automate the processes and tools that are being used. Related to community as well as environmental justice, enhance the outreach and technical assistance, and then develop and implement tailored environmental justice best practices. Now, Matt has a few more recommendations related to permitting and compliance.
Thanks, Marty. So our permitting program recommendations are listed here in these bullets, but they are quite technical, and so I'm not going to go through them individually, but more or less what we're suggesting is that AQMD take some of these and apply a certain degree of rigor to its permitting process that we've learned over time are important to make sure that the regulations and public health are fully protected. So if anybody has specific questions about these, we can come back to them, but they are quite technical, so we can move on to enforcement. So in the compliance program, we're recommending that AQMD enhance inspector health and safety training, clarify enforcement criteria in its procedures and training, implement a more robust civil penalty policy, enhance the visibility of compliance assistance resources, and then increase compliance data transparency.
Okay, and with that, we're at the end of our presentation, but we are available here to take any questions that you might have. Again, some of the questions will be, the details will be in the audit report, but we're going to open it up here for questions, subject to whatever time limits the board may have.
Thank you, Mr. Wolf, and thank you, Mr. Haber, for the presentation. Are there any questions? Mr. Driscoll.
Thank you. In relationship to the metrics that we might be compared to, are these national metrics or are they regionally adjusted for the environment that we live in being totally different than other environments might be?
Do you want me to take that, Marty?
I think so, yes.
So we did a number of surveys, for example, looking at staffing levels, and we made a strong attempt to try to compare AQMD's programs to other agencies that had similar sizes in terms of population, in terms of the source mix, in other words, the type and sizes of industry. It's hard to be exact there, but we looked at about 6 or 8 other agencies and tried to use those metrics as much as we could.
Thank you.
Thank you. Any other questions? Mr. Anderson?
Yeah, actually, just a clarification of his response there. So I just wanted to make sure, so this was pretty much nationwide, you were just looking at similar sized communities?
That's right. Size it's hard to say size because there are a couple of different metrics, but we did look at both population and at the number, and as much as we could at the types of air pollution sources that were permitted by the different agencies. We did include, for example, Clark County Health District.
Okay, thank you.
If I could just add to that really quickly.
Sure.
I think what we found is that air quality agencies just vary so much from jurisdiction to jurisdiction just because the needs of the community differ. For example, here in Washoe County, we have an asbestos program. Not every agency across the country has one of those. We also have a wood burning device program. again, that's pretty unique to us and a handful of other agencies kind of across the West Coast. So, just trying to compare one jurisdiction based on population is very difficult because, again, just the programs and the needs of the community just vary very much.
Thank you. I have a couple questions. I believe this may be to Mr., I hope I pronounced your last name, Haber? Haber, thank you. Obviously, on the report, there were a real variety of both sources in terms of reviewing various different industries, and then even your on-site visit, the 12 on-site visits that you did. And I'm just wondering, again, we're a variety of different industries, which is great. And I'm just wondering, were there any specific industries that may have rose to have more common concern or issues? I hate to use the word concern, but may have things that were commonly addressed that might be related to the actual industry? Because there are some common industries that can be sectioned here, and I was just curious.
Yeah, on the permit side, and I'll ask Dan to respond on the inspections.
Okay.
Of the issues that we flagged, there actually did not seem to be any particular industry type that was more, again, using your words, more problematic or more of a challenge for AQMD in terms of addressing. It was really categorical issues. For example, the one that I mentioned earlier, where we looked at the kinds of emissions that were captured or not captured.
Thank you. And I guess I'll ask Mr. Wolf the same question, if there was anything from your perspective.
Actually, with regard to compliance, Dan, can you provide any clarification on that question?
Sure. Good afternoon. So I was the one who went out with your staff on the inspections, and I would say I didn't really see anything that was highlighting a particular industry of concern. In the visits that I did, I visited, for example, multiple gas stations with different inspectors to sort of assess consistency across inspectors, as well as some, automotive spray coating facilities. So it wasn't industry so much as sort of, I would say, sort of complexity of a facility. A gas station's pretty straightforward, and one is very similar to another. But there were some of the larger, more complex facilities that are not currently permitted as major sources that we highlighted some concerns where maybe with a better look at the potential to emit for those sources, they might be actually major sources. And I think that would be sort of a key area that's not defined by an industry, but sort of size and complexity of a facility.
Well, thank you. I also really want to take a moment because, and speaking with Dr. Kinsley, it's not just, and I'm still new to the board, so maybe it's just because it was really impressive to learn that the board, you all, had really looked at this through, Dr. Kinsley and staff to have a third party actually look at a deep dive. And that's how I see this. It's a pretty deep dive, and the report is very robust. I think that there's something to say when you're talking about defining, for instance, roles and responsibilities, and then that accountability that attaches to that, right? And so I guess my question is really probably to Dr. Kinsley in terms of, now that we have this information, what will be, for instance, I'm thinking out loud to the strategic planning meeting and the dashboards and all the things that are happening and how that's being connected. And then this is a respectful statement, but being that I have also been under performance review and then held to those standards, and we all have probably experienced having a third party come in, do a great analysis, look at what can be done, start implementing those changes. And kudos to staff, by the way, because I heard Mr. Wolf very clearly say that internally some of these things were starting. So it wasn't like you were waiting, if you will, for ERG to come in. But my real question is, how do you now start? You know what these recommendations are, moving forward with the implementation and execution, but also the accountability, and how do we measure that? So I'm guessing I'm looking to Dr. Kinsley at that.
Sure. I'll comment first, and then I'll turn some time over to Director Vega, too. So we started with this process, and we began, so as an example, we started first with our community and clinical health services. We identified, same thing, brought in a third party where we were able to do this deep dive and where can we improve. And so since we have a process management in place, we have begun to implement those things. And it also goes into our budget, where can we be effective and overall, but also how do we provide the work environment that is effective both for our community as well as our organization. And I do want to say kudos to Director Vega for what he's been doing within his division to be able to take these initial steps and improve. And we've seen reflections of that within our community up to the response times, as well as recent meetings with our communities such as AGC on them acknowledging their turnaround time on their permitting process and the response time to both asbestos or any of our projects within our community on how they're handled and communicated with our community. So some of those are reflected as that of those changes. But again, we sit down then as leadership after this and go through these and where can we help implement, and then we help drive those as part of our, as you mentioned, with our dashboard, our strategic plan, as well as within our future. And we've done that with CCHS, doing that now with air quality, and then we'll be moving to our other divisions. And Director Vega, I don't know if you want to comment on any of that.
Yeah, really just before I address the question, want to reiterate what the Vice Chair said as far as this process is very valuable. And we welcomed it. It can be scary when you get somebody from the outside coming to take a look at your organization. But again, we challenge ourselves to be the best and make sure that we're providing the best service to the community. So we really welcomed it. And then again, the staff were open and transparent. So what you're getting is an authentic view of what our organization is. My take from the assessment was it really just verified all the things that we were kind of already thinking. When I first started about 5 years ago, we had a lot of transition, a lot of turnover. I think over 40% of our staff has less than 5 years. So, which is a bad thing, but also a good thing in that it kind of brought new perspectives into kind of what we were trying to do. The organization was stuck a little bit in the 90s as far as the air quality perspective. And the first step in really modernizing our organization was that regulation change. That provided us the tools to be successful in everything else. Better permits, better compliance, more objective enforcement if that is necessary. So again, really the assessment really just kind of verified everything that we were kind of already starting to put in motion as far as modernizing regulations. We recognized that permits needed to be improved. Again, we have started that process. The regulations are going to allow us to take more frequent look at permits, where before they weren't looked at more than once, maybe in a 20-year period. Now we're going to get a look at every single source at least once every 5 years, which allows us to make sure that those permits are achieving what they should be, which is setting up the facility for success, but also protecting public health. And then from there, again, it helps us with compliance and all those things. So I hope that answered kind of your question as far as what the next steps are. Again, the regulation was the first step. We're making tremendous strides in the permits. I think our first set of renewals is going to be coming in the next few months. And that'll be probably like a 5-year process where we're going to touch every single permit at least once. So those are kind of the next steps.
No, I appreciate it. And I guess I'm just trying to do what you're already doing. And number one, thanking you all too. But the reality is that sometimes what happens, I'm not saying this is this case, but you have a third party come in and then it's not necessarily measured, and it's not necessarily attached and aligned with a goal, right? 'Cause you can't, it's how do you eat an elephant, right? You can't necessarily, you can get all these recommendations, you can't overnight wave a magic wand and just have everything be running exactly as it should. So there are strategies and implementation and execution, but also that accountability, and that's where I'm coming from. And I just wanted to see if it was coming into, but you answered that it is going to be incorporated in the dashboard. And I guess the only thing that I'd ask is that if in fact, to the point of, again, a third party, ERG did a great job, whoever it is, but if they're making whatever these important recommendations are, and there isn't a budget to support it as well, I think that we have to also be apprised of that as a board, because that's our responsibility in terms of trying to ensure that the resources are there to do the job as best as can be, to your point of having this goal of excellence. So I would just want to make that comment, because it is important, and I think that we sometimes get these reports and everyone's trying really hard, but if there's barriers, we also need to identify what those are, and if resources are part of that, then I think that that is important as well, because you can't be held to something that you can't execute. That's where I'm getting at. And that's where it ties in, to not only this division that's going through it, but all the divisions that are going through. So kudos to all of you. It's a big lift when you have a third party come in and you're like, okay, how do we get all this done? So I appreciate it. Thank you.
Just to comment on that, and heard, I think it's a wonderful opportunity for our next strategic planning, that not only with our dashboard, also when we have these assessments for the next 3 years, we define, we can say we've paid for these, we need to use them correctly.
That's right.
And so as part of the board, then we will bring to you then in our next strategic meeting, if it's in November, that these, what these things, how they were incorporated into it, are we meeting that, and have we used this correctly? So that's a wonderful opportunity for us to do that, so thank you for that guidance. So,
Thank you. Mr. Driscoll.
Question on policies and procedures and best practices. We've identified through this great study the things that we're doing and that might need to be modified, or things that we need to start doing. Did they provide us kind of a priority list that says a best practice would be to go work on this first? And then again, noting that budget is going to be a constraint? But do we have kind of a map of what should we tackle first, second, and third?
Is that a question for myself, or would you like ERG to take a shot at that?
Whoever would best answer the question. So I'd start with you, I think.
Okay.
Since you're going to be the one on the ground doing it now with their resource.
Yeah, absolutely. So I think from my perspective, the first step, again, as I mentioned before, was the regulation. It really supports everything that we do within the organization. So that was a huge first step in getting us to where we want to be. The next step is getting the permits to where we want them to be. And that's going to be a process. We have between 600 and 1,000 permits. So that process is not going to happen overnight. But we're aware of that. And again, it's a big change for industry as well. So we can't, take this too quickly, or else we're going to set everybody up for failure. So again, we're trying to consciously, progress and modernize our program 30 years in about a 5-year period, and that's a lot. But staff are up for it, and I think they recognize the challenge, but I think they also recognize the importance of it as well. So, like I said, it's a probably 6-year process, but priorities, again, regulations, and again, you probably see us up front of the board with regulations more than just about everybody. We had a 030 in September. You just saw our asbestos regulation. Probably before the year is over, we'll have our dust control regulations in front of you as well. And again, we really recognize that the regulations really guide us in everything that we do. So we prioritize regulations, permits, or kind of the next step, and then in the field, making sure that we're working with industry and making sure that they're being successful as well.
Thank you.
Yep.
Thanks. I was wondering that too, so thanks for asking that question.
I don't know if ERG had anything to add to that.
Yeah,
I don't.
Oh, go ahead.
I don't think we do. Francisco, I think you covered it. I think we consciously within our team did not try to rank things. I know we all have our preferences. Matt is a permitting guy, so for him, permitting is number one. Dan is a compliance and enforcement guy, and so for him, that's most important. I do emissions inventories, which isn't even really wasn't covered in our scope, but I think they're important. So we tried to keep a higher level and look at things on the whole. And it really, as Francisco said, it really comes down to the local priorities. Things are in motion, and whatever changes need to be made need to be in consideration with what is in motion already, with the understanding there are some things that can be brought along at the same time. And as previously mentioned, always there's a money aspect to it as well. Again, Matt has his ideal world of permitting and so forth, but we understand there are real world constraints as well. So again, we kind of took a high level and tried to stay away from the rankings and look at it more holistically, I guess is the right term, but that's kind of where we came from.
Thank you. Any other questions? Well, thank you, Mr. Wolf, Haber, and Roper for a great presentation. Thank you, Director Vega, for all of your hard work and the staff. This is an action item, so I am going to call for public comment.
I had no request for public comment.
Okay, hearing no public comment, I entertain a motion at this time. Mr. Driscoll.
Second.
Okay, we have a motion by Mr. Driscoll and a second by Mr. Brown. Any discussion? Do you want us to read the motion?
It's unclear what the motion is. Approval.
It's on page
I'll be happy to do that.
2 and 2. Oh, sorry.
Okay. I would move to accept the ERG organizational audit of the Air Quality Management Division as presented.
Great. See, we're so forward-thinking. We all knew that he said that without saying that. Did you see how that worked? Great job, Mr. Driscoll. Okay, do you agree with that motion, Mr. Brown?
Second.
Thank you. So we have a motion and a second. Any further discussion? All those in favor signify by saying aye.
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 Any
Aye.
opposed? Motion carries unanimously. Thank you, and thanks again to everyone's hard work. That's a lot of work in that short period of presentation. That is a lot of work. We're going to move now to item 11, presentation and possible acceptance of the 2024 Community Health Improvement Plan Annual Report. Ms. Lavoie.
Alrighty, good afternoon, members of the board. Rihanna Lavoie, Director of Programs and Projects for the Office of the District Health Officer. Today in my presentation, I'm going to talk about the progress of the Community Health Improvement Plan, and I'm also going to refer to the plan as the CHIP. Before we dive into the CHIP annual report, let's take a moment to ground ourselves by reviewing the critical role of public health, and more specifically, the role of NNPH. This foundational understanding will provide important context and help illuminate the value and the significance of the efforts behind the CHIP. At the center is NNPH, whose role is to promote, protect, and enhance the health and well-being of communities through prevention, education, and policy initiatives tailored to the specific needs of Washoe County. So as you can see through this visual, the public health system is interconnected with multiple sectors as health outcomes are shaped by a broad range of economic, social, and environmental and political factors beyond traditional healthcare services. So as we take a look at effectively improving the health and well-being of our community, it's important for us to adopt a holistic or a systems-based approach that recognizes the related nature of these factors so that we can focus on transforming the underlying structures of policies and those processes that influence health outcomes. Because of the interconnectedness, NNPH fosters collaboration across sectors so that we can drive meaningful and sustainable improvements that address the root causes of health disparities and strengthen the overall resiliency of our communities. And that's what we're going to talk about today, more specifically through the Community Health Improvement Plan. So the Community Health Improvement Plan is a strategic framework developed in collaboration with healthcare providers, community organizations, and local stakeholders. And really its sole purpose is to address and improve the health needs of Washoe County through 4 prioritized health issues and targeted solutions that were identified by the community. The CHIP was created using the community health assessment data, which showed us where poor health outcomes are affecting our communities here in Washoe County. Because this is a collaborative process, Northern Nevada Public Health is charged with tracking and evaluating the progress of activities to ensure that the initiatives are effective, they're efficient, and we're actually making meaningful change in our community's health. We also act in many ways as a convener or a facilitator to facilitate conversations to improve community health. And then, of course, we also prepare an annual report which aims to contribute to the overall transparency and accountability of health improvement efforts. So we want to acknowledge that there are numerous areas where we recognize the need for improved health outcomes without question, but we also have to acknowledge that from a resource standpoint, the community has limited capacity to address all of these challenges simultaneously. That said, the CHIP takes a data-driven approach that allows us to make informed decisions about how to best allocate resources and implement programs that have the greatest impact to actually improve the most pressing health challenges, such as mental health, access to health care, social determinants of health. And one of the core activities of the CHIP is to collaborate with partners to ensure that organizations across the public health sector, such as community providers, our government agencies, our elected officials, and our residents align those efforts with the community health needs so that there's shared ownership and there's collective momentum in achieving similar health goals. Another core element of the CHIP is that it provides clear direction for resource allocation to ensure that funding, personnel, and other resources are used effectively and efficiently to address the highest priority health challenges. So by aligning these community investments with the health priorities, the CHIP maximizes the return on public health expenditures and supports long-term and sustainable improvements. So as I mentioned, an important part of the CHIP cycle is using data from the community health assessment to inform our approach and implementing strategies to improve the health of the community. In our community health assessment, we started by completing a comprehensive review of over 100 metrics at the very beginning to ground us where the needs are. We then met with partners through a community forum where over 200 organizations came to prioritize those critical health issues. Now that our CHIP is developed, we meet with partners regularly during the CHIP cycle, which is about a 3-year time period, to discuss any new data, resources, as well as our capacity to ensure that our approach reflects the evolution of our community's needs. Oops. The annual report. This one's good. Thanks, Steve. We'll leave it right here. The annual report is a highlight of activities accomplished by our partners in implementing all of our activities in year 2. The CHIP includes 4 focus areas, which are the social determinants of health. We have access to health care, preventative health behaviors, and mental health. At a very high level, 79% of those deliverables that were planned in year 2 were accomplished, which is a notable achievement given the tactics that we have included in this plan. And for the purposes of time today, I'm only going to talk about a few initiatives, but if you want more information, you can head over to our website and look at the annual report. To no surprise, mental health is one of our top priority areas that is being addressed through a combination of targeted and systems level interventions. Work groups have made progress by completing at least 70% of the deliverables in year 2. We'll start with the Washoe County Regional Crisis Response System, where stakeholders have made notable progress in standing up that crisis system. Most significantly, the Crisis Care Center is now open to the community. And this is a significant milestone. In our last community health improvement plan, which was 4 years ago, we started with this effort, and the tactics were really around looking at data and having conversations about what would be possible. So as I mentioned, it's incredibly rewarding to see this building come to fruition, but it's also a testament as to what we can achieve together when our community is focused and we're grounded in working together. The purpose of the response system is to ensure that those experiencing a mental health crisis have someone to call, which is 988. They have a team to deploy, which are the mobile crisis units, to offer outreach and support to meet those where they are, and somewhere to go, which is the Crisis Care Center. Now carrying that work forward, we have the sequential intercept model, which is in the CHIP. And while this project is still in its infancy, partners have made significant progress to pull together data to develop recommendations designed to promote a more efficient and effective justice system for those individuals. Steve, can you help? There we go. So the significant progress to pull data together so that they can make recommendations designed to promote a more effective and efficient justice system. And the purpose of this project is to divert people with mental and substance use disorders away from the justice system. So we're going to use this visual for just a quick second. For example, in Intercept 1, this would involve diversion performed by law enforcement that allows people to be diverted to treatment instead of being booked into jail, where an individual's illness during their stay could potentially be worsened, or when they are discharged, they're likely facing gaps in care services. From NNPH's perspective, this is critical as our approach has often taken directing these individuals to either an emergency room or to jail, options that only fail to provide the necessary level of care, contributing to poorer health outcomes. And they also come along with significant costs for both individuals and the community at large. One of NNPH's more targeted efforts is the Acantre Nos project, and this initiative is a direct response to the community's need for culturally tailored services that help reduce stigma surrounding mental health in our Spanish-speaking community. Over the past year, the core team has successfully established a partnership with the Washoe County School District to provide Spanish-speaking families with valuable information and a space for open conversations about mental health, as well as guidance on where to access youth mental health services. Preventative health behaviors is the second priority area. Work groups have made progress by completing 80% of the deliverables in year 2. And so in this focus area, we have a program called Prescription Pantry, which is a partnership between the Food Bank of Northern Nevada and other healthcare entities. And the program is really about patients who face food insecurity are connected with food that they need to help manage their diagnoses, such as heart disease or diabetes. And compared to last year, these pantries have seen a 32% increase in redemption rates, which indicates that more individuals diagnosed with a chronic illness are accessing the foods that they need, like heart-healthy foods. Additionally, the program is beginning to observe positive changes in health outcomes in the clinic setting, and we anticipate being able to bring more information or detailed information in the coming year. Another program is 520 Healthy Washoe, which aims to create healthy environments so that families can make the healthy choice the easy choice. NNPH expanded their footprint into additional schools, and they're working with the school district to revamp and structure the setup of lunchrooms to support student health and by providing students with more opportunities to engage in physical activity. And to expand on this endeavor, we're also working with closely with partners to create healthier neighborhoods within communities with the same idea to create healthier environments where the healthy choice is the easy choice through our Healthy Corner Store project. The Chronic Disease and Injury Prevention Team has expanded outreach efforts to ethnic markets to offer healthy produce and recipe cards in areas that have low access to grocery stores. This team is also looking at exploring options into expanding this effort into other communities who are potentially facing barriers when accessing food. The social determinants of health is our third priority, and the subcommittee accomplished 75% of the deliverables planned in year 2. New this year is the financial plan to Open Doors project to improve financial stability in the Spanish-speaking community. As we know, financial stability ensures that individuals can meet their essential needs like housing, food, transportation, and when we lack that access, these can also contribute to chronic illness, perhaps stress or poor nutrition. So with great success, we partnered with other community organizations to provide 10 classes in the community, and it also is gaining traction, so we anticipate being able to reach more of our community members in the coming year. Also included in the CHIP are efforts to improve language access in our community. It's a critical piece to achieving access to services and improving the quality of life for those experiencing health disparities. NNPH staff have worked very closely with other county departments to stand up the Language Line and Wordly AI, which are 2 resources that offer translation or interpretation services so that those who are seeking our services can access the care that they need. And finally, our fourth priority area is access to healthcare, and work groups have accomplished 100% of the deliverables planned in year 2. NNPH has partnered with a core team of community partners and healthcare entities to host 3 family health festivals across the community, and these events provide a hub of direct healthcare services in under-resourced communities that are likely experiencing barriers to care. On average, about 50 partners participate in these events, which bring a wide variety of services and direct services. So it's anything from dental services to personnel that are on site to help families complete applications to access basic needs. And lastly, the Health Equity and Loan Assistance Program is now available to the community. During the 2023 legislative session, NNPH supported policy efforts that advocated for $5 million in funding for loan repayment for healthcare professionals. And to expand on those efforts, additional work has been implemented to improve the public health workforce through the ARPA-funded Nevada Health Workforce Pipeline grant. So as we reflect on the progress made this year, it's important to recognize the positive stride we've taken with our partners toward improving community health. However, as with any effort, there are areas where we can improve to further enhance our impact and ensure that we're effectively addressing the community needs. These topics underscore some of the critical insights and stakeholder feedback that we receive regarding areas for improvement. So as we're looking ahead, we're committed to implementing the identified initiatives in collaboration with our partners to enhance health outcomes in alignment with those 4 priority areas that we discussed. We're also going to continue to engage in conversations with our partners to explore strategic adjustments, our investment opportunities, as well as collaborative efforts that will optimize our impact in the future to come. And with that, I'll take any questions that you might have.
Thank you. Any questions? Mr. Driscoll.
With the health assessment coming up during this year, and we're 25% all the way through year 3 in the CHIP, when will that process get started?
I'm so glad that you asked. We get to start that process at the end of the year, so we're already having conversations with Renown. That's one of the core entities that helps us conduct the community health assessment. So we started that process. We should have a project plan in place in the next couple of months, and then we'll start gathering our steering committee to be able to determine what community indicators we're going to look like. We anticipate that the community health assessment will likely be done by January so that we can have another community health improvement plan in place.
Thank you.
You're welcome.
Any other questions? Yes, Dr. Duarte.
I wanted to make a comment.
Sure.
I think that your focus on getting people out of the jails is really an important one. During my time there, we probably had 300 to 400 patients that had primary mental health disorders that were being incarcerated at high cost, and they weren't getting all the health services that they needed. And I saw more metabolic and genetic disorders during my tenure as a medical director at the jail than I saw in 45 years of practice in various settings. So I know a disproportionate number of people with metabolic and mental health issues are being directed or getting their primary identification of a problem by going to jail or breaking the law and being incarcerated at high cost, both to them and to the community. So I think it's really important. And looking at your stakeholders, I didn't see law enforcement on there, and that might be an important place to look, because very often when people are a danger to themselves or others, those are the first people that intervene, and then they go into the legal system rather than the healthcare system. So those are my thoughts and observations.
Thank you. Any other questions or comments? May I ask Mr. Anderson first, really quick? Mr. Anderson.
No questions, just the comment that it's great to see these outcomes, so well done.
Thank you, Dr. Chin. Dr. Kinsley.
Thank you. So coming into this and coming up on my first year and learning this process, seeing the process here with the Chan chip and the opportunity, and just to recognize a few things, so this is part of our initiative. When there's services in the community, we don't need to be the service provider. So we're not duplicating these services, or in many sense, public health is many times the stopgap that we're the last option many times if something doesn't exist in the community. And so this is definitely Northern Nevada's public health emphasis to, does it exist in the community and how can we help strengthen that? And this is a wonderful opportunity. It does involve part of our budget, and there are challenges to that we'll have to recognize, and we may have to cut back on this if we have to in these coming years, seeing where we're at. But we will strive to continue to maintain these and recognize and use the next Chan chip to really emphasize those points. But we are happy with making the difference in our community that is long-term. When we make impacts in children's lives, they carry that to their children. And so that's really always the, I was going to revert to Spanish there. I was going to say siempre, but sorry. But in speaking on that, but just saying that, we make these impacts and sometimes we don't see it for generations, we don't see it for decades. So I do want to acknowledge the great work that has been there in the past and moving forward on those points, and thanks for the board's support on that. And we'll see and how we move forward in the future. Thank you.
Thanks. Well, considering that you wanted to express such deep emotion, that's probably where that came. I too would just like to commend everyone in terms of this commitment. I would like to take this opportunity to thank the investment by this board, specifically in the area of the sequential intercept model and the crisis response in terms of Washoe County's involvement with that. And the fact that, there are now 9 community partners that have entered into that space of mental health. And it sounds like a public service announcement next, but on April 25th, there is a Sequential Intercept Model Summit. It's my understanding that it is full. However, if anyone is interested in attending, it's free. I would encourage, I've already registered, I'd encourage all of us on this board to go. The Sequential Intercept Model Summit, I went to it last year. This is the second annual. Not only will we get to hear, for instance, how things are going, and then more importantly, what things are those next steps, and hearing from law enforcement, hearing from case managers, hearing from the court system judges. So if you are interested, by the way, I don't have special tickets, but I do know, because I had some constituents who wanted to attend and it was full, and I contacted someone here in Washoe County. And so if anyone in this board, I'm guessing Dr. Kinsley might have a red line phone too, but I certainly would encourage you to attend. So thank you to the Northern Nevada Public Health for supporting those two initiatives along with all the initiatives. But I'm becoming more and more deeply involved in this sequential intercept model, specifically in the standing up of the Washoe Behavioral Center. That is going to be critical to all of our work. So thank you to you and all of our partners, and to the leadership and staff and the board. This is a heavy lift. It really is. I mean, you went through a short period of time of impacting pretty much everyone in our community, every organization in our community, whether it's the hospitals, law enforcement, whomever. So it really is amazing that it's not only really broke how you've broke it through CHIP and the CHA and the assessment, but then it's measurable, and we can see what those areas are that need to hopefully, the budget won't be an issue, I hope. I will just commit that I'm doing everything I can from Washoe County perspective, because I realize, we all realize how important this work is. So we've almost kind of just started. That's how I look at it. And so we need to keep that train on the track, because there's good outcome, as Dr. Huarte said. It really is not surprising how much it costs to incarcerate someone, if you will, that really is not needed in terms of public safety as defined. If it's a mental health issue, that's not where it needs to be taken care of, and the cost to taxpayers is unbelievable. So I'll leave it at that. I'm going to read, that's my pitch on reminding the budget of how much it costs. So anything else? Any other questions? I believe that we need public comment, if there is any.
I've received no request for public comment.
I'll entertain a motion to be read.
Move to accept the 2025 Community Health Improvement Plan 2024 Annual Report as very well presented.
Thank you, Mr. Brown. Do we have a second?
Second.
Second by Mr. Driscoll. Any further discussion? Hearing none, I'd ask if you can signify by saying yes if you agree with the motion.
Aye.
Aye.
All right. Any opposed? Motion carries unanimously.
Thank you.
We'll go ahead and move now to item number 12, which is a discussion and direction to staff regarding legislative issues proposed by legislators. I'll turn it over to Dr. Kinsley at this point.
And I'm going to go ahead and turn it over to our Government Affairs Liaison, Joelle Gutman-Dotson, and she is online.
Hey, everybody. Good afternoon, Board. For the record, my name is Joelle Gutman-Dotson with I'm Government Affairs Liaison for Northern Nevada Public Health. Just giving you a brief update, pretty high level. And if you have any questions, please let me know. But these are the things that I thought you would find important right now. So as of today, I'll start with April 4th. Budget item 3234 will be closing. And that budget item has the $15 million reserved for public health that was recommended by the governor's executive budget. So we are eager to see that close on April 4th. AB 102, a bill that deals with emergency services that would grant us giving us permissive language that would let us license ambulances and first responders, paramedics and EMTs, not all first responders, just paramedics and EMTs. The title is Revising Provisions Related to Emergency Services. AB 102 was in a work session last Friday and it passed. So expecting to see that on the floor of the assembly soon. SB 295 is a big bill for us. This is changing definitions related to cottage food. This has history from last session related to food cart vendors. And this bill, even as amended, we've gotten a lot of things taken out of it that we opposed. We remain opposed. And that bill was heard Tuesday night. Rob Frida and Byron Collins from Environmental Health joined me at that hearing. It was a 3.5-hour hearing. There's a lot of bills heard that night, but they came down to help me testify on that. Two of us testified on that in opposition. We have good company in opposition for that bill. Clark County opposed it. Southern Nevada Health District opposed it. Central Nevada opposed it. The resorts and the Chamber of Commerce also opposed it. We're continuing to work with Senator Dunyate on that bill to see if we can find any common ground. We have a meeting tomorrow to discuss further. There's another bill called AB 352, which also addresses cottage foods. This one is also expanding on the definition of cottage food, but moving cottage food out of health districts and local authority to the state, which we also oppose. We have a working group that we're meeting with tomorrow to discuss that bill and see if we can work through some of the things that we oppose in that. That bill was heard on March 17th, and Amber English from Environmental Health Services came down. I thought there might be some subject matter expert questions with that bill. There weren't, but Amber did a great job testifying. And then still, we have a working group with that Assembly member, Natha Anderson. She's heading that bill. April 8th is a UNR School of Public Health Day, and we are participating in that. We'll have a table set up. And those were the main bills I wanted to share with you today. We do have a big day next Tuesday. There are 3 separate tobacco bills being heard, all that do different things and all that impact our tobacco prevention efforts in different ways. So we are either submitting testimony or will be verbally testifying on those bills mostly in opposition, trying to find a path forward for one of them. I forgot to mention, sorry, it's been a busy day. There's currently 540 Assembly bills and 450 Senate bills. We're tracking about 200. Just monitoring 200, but we are in a lot of bills this session, more so than I've ever seen in the 6 years I've done this for Northern Nevada Public Health. Lots of different impacts, sometimes intended, sometimes unintended. So lots of conversations with bill sponsors or different groups that, where we have to educate, like, hey, this impacts us and let me tell you why. This is why we don't like it, or this is why we like it. I would say we're playing more of a defense this session than really wanting to see anything passing. April 11th is a big deadline day. That's the first House committee passage deadline. And I'm very much looking forward to that day because hopefully a lot of these bills will die. So, and then kind of more work can be focused on the pieces of legislation that really are intended to get out of this session. So that is my update. I figured there'd be some questions, so I'm here for questions.
Thank you so much. Any questions? Any questions? Mr. Anderson?
Nothing for me.
I have a quick question. We just saw an incredible presentation with a previous item by Ms. Lavoie, and one of the items in terms of the CHIP that's being tracked is, the acronym is HEAL, and it was funded essentially by ARPA, is my understanding, and I'm just wondering if there's anything that's dealing with that legislatively. I mean, how does that continue to get sustained? I know it's partners, but I'm just curious. And I'm not even sure that that's a fair question. Maybe I can talk about it offline.
I'm not familiar with the HEAL bill.
Yeah, it's not a HEAL bill. I just realized that I'll just talk to Dr. Kingsley and Ms. Lavoie after. Anyway, it sounds like you need some
I
great
can
food.
speak to one thing that Brianna mentioned. There's a bill, and it's not through ARPA dollars. It's actually through the Treasurer's Office, where there could be a different bill. I think there is a different bill, but this bill in particular deals with money, unclaimed money from the Treasurer's Office that has gone towards tuition reimbursement for various healthcare professions. And this session, we were able to add public health professions to that bill. So that is in line with our CHIP. But I am not familiar with the HEAL bill, and I can talk to you offline about that bill.
Okay, thanks. How much money is in that, just out of curiosity?
It's not a ton of money.
Oh, okay. Every
and
little bit
it's
helps.
Yes, it covers 100 scholarships, and last year 800 people applied.
Oh.
So it's not insignificant, but adding public health professionals to the definition is helpful for our workforce development.
Great. Anything else by anyone? Dr. Kinsley, do you have anything? So considering this is health, I hope you're taking care of yourself. Being that I walked those halls for years, I can tell you, we all need to send really healthy food, drink lots of water, get lots of rest. You'll be, really on the trajectory of fast pace after April 11th. You can breathe for a moment and then take another deep breath, right? It's like you can breathe for a moment and then, phew. So we're all behind you. Thanks for the great work. Thanks for the succinct reporting. And seriously, thanks for all you do.
Thank you, Vice Chair.
Okay, we'll move now to staff reports. Dr. Kinsley, 13A, which is air quality management. Mr. Vega.
Is this on? Oh, there we go. Thank you, Vice Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just a few highlights from the report. The burn code season did conclude at the end of February. Happy to report that this year continued our streak of 0 burn code days that goes back to 2017.
Wow.
So that is a tremendous achievement. If you are aware of what wintertime particulate matter pollution looked like in this region, to say that we've gone, 8 years without having a red burn code day, that's, again, a tremendous achievement. And then furthermore, the last wintertime exceedance was recorded back in 2013, so even better statistics there. I did want to mention that going back to the assessment and doing more community outreach, we did have a permitting workshop that was held on March 20th. I mentioned that we have revised regulations that have new requirements for permit holders. So we're trying to do as much outreach and education. So when applicants are submitting these documents, they're set up for success. So it was fairly well attended, about 30, I think, attendees. It was a virtual meeting. It was recorded, and we will place the recording on our website. So even if you weren't able to attend, you can go to the recording on our website. In addition, we also have another workshop coming up on April 4th. And this pertains to our dust control program. Obviously, the summer months are fairly busy for developers. So we wanted to hold our workshop and just kind of a reminder that we do have a dust control permit program, what the requirements are, what resources are out there available to stay in compliance, things like that. So I encourage anybody that works in the development industry or disturbs dirt to please attend that. Again, we will record it, so even if you're not able to attend it live, it will be on our website, and you can go back and look at it at a later date. Lastly, I think it was mentioned in the audit as well, we've been really trying to be proactive as far as providing staff or being available to the business and industry at their convenience. So as of, I think, last week on our website, anybody who has a question or needs specific assistance can schedule time with our staff. You don't have to call. Again, you can just go to our website. You have to answer a few questions, and you can pick a time that is most convenient for you, and you can get direct assistance within, again, our staff to answer whatever your questions are. So, again, really trying to be proactive as far as making sure that everybody is being successful. We're going to continue this, and right now the hours are fairly limited to kind of 8 to 5 when staff is working, but we hope to expand that to after hours. We recognize that 8 to 5 is typically when businesses are working. So hopefully we can, again, expand that to after hours. But that's my update. Happy to answer any questions.
Thank you. Any questions? I would just make a quick little comment. Sometimes it's even before hours, like with the construction industry, when it gets hot, like they start like when the sun's coming up. So not that I'm trying to have anybody set their alarm at, 3 a.m., but I'm just kind of throwing that out. You've probably already thought about that. Thank you.
Yep, thank you.
We'll move to item 13B, Ms. Lotritz.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services. For the record, I brought our small but mighty TB team with me today. We are missing one member, but Monday was World TB Day. March 24th was World TB Day. And I just wanted to just introduce you to our team since they don't often get to come and see you. We have a slide. I don't know. Oh. Gotcha, okay. So just for comparison from 2023 to 2024, it shows you the number of active TB cases. So saw just two additional cases in 2024. The number of people that our staff is evaluating continues to increase, as well as the number of latent TB cases we're treating. The number of consults with community providers stayed pretty much the same. But we are seeing an increase in positive TB cases being reported. And just some not so fun facts down there at the bottom. It is it's the world's oldest and deadliest infection, killing over 1 million people annually. 1/4 of the world's population has the TB bacteria in their body. And TB cases in the U.S. rose 15.6% from 2022 to 2023. And although 2024 data have not been published by the CDC yet, it's looking like TB is continuing to rise in the United States. So I want to now let Jennifer just tell you a very short story about one of our clients.
Good afternoon to you all. My name is Jennifer Mendez. I am an RN case manager for the tuberculosis program, for the record. So like Lisa mentioned, March 24th was World TB Day. So I am here today to share a story about one of our patients with the sole purpose of bringing awareness to the potential impact of TB disease, because it not only impacts the individual, it impacts those around that individual and ultimately the community as a whole. So our current patient is an almost 2-year-old US-born male who was born to full term as a completely healthy baby to a first-time mom. Unfortunately, in the household, there was an adult with active TB disease. And what I mean by that is that they had an active infection, TB was in their lungs, and while this person was breathing, coughing, sneezing, the bacteria was being expelled into the air, being inhaled by the baby and the 26-year-old mom. Consequently, they both progressed into active TB disease. So for our patient, as the infection progressed, his health declined and he ended up hospitalized. There, he was diagnosed with TB not only in his lungs, but also in his brain. So even though he was started on TB therapy, he still had major complications. A big one of those was recurrent collapsed lungs that required recurrent insertion of chest tubes to allow for the lungs to re-expand. At one point, his lung collapsed, his heart stopped, and he had to be resuscitated. This patient spent months in the hospital in critical care. He required rehabilitation as well as multiple specialist evaluations. Today, his chest tubes are removed, his tube feeding is removed, and he has completed 193 days of TB therapy. He will continue this therapy until August of this year. So he has started walking, he smiles, he laughs, he waves, and if he really likes you, he'll blow kisses your way. So he has really inspired our team with his fighting spirit, and honestly just allows us to reflect as to why we do what we do. Thank you.
Wow. Thank you for sharing that.
Yes, thank you, Jennifer. And this team is in contact with these clients every day, so they really get a chance to know them and get connected. So that is all I have. I'm happy to answer any questions about my report or anything else.
Dr. Kinsley.
Thank you. Just want to, one clarifying point, they mentioned that the child is being treated to August, but any of those cases up there, it's not only the active cases, but those 138 cases, that is 6 to 9 months of daily treatment that has to be observed and maintained. And just because of any times it's stopped, then the severity of that disease come back. So what they do and what they interact with people in the community, and is really prevention. And if our prevention is better, then we could have prevented that child having gone through that. So that's always our goal. So, and that's where we shine, is we prevent that, and we don't realize what that can do to a child. And it's been a long time, and so hopefully we continue that within our community, that prevention role. So thank you. Amazing job.
Madam Vice Chair, may I?
Of course, Mr. Anderson.
I do not have a question, but Lisa, I just want to say thank you for introducing us to our team. And ladies, you all are awesome. I truly appreciate the work you're doing. Jennifer, thank you for sharing the story. I have to admit, having lived my whole life in this area, I did not realize how prevalent it is. So thank you for sharing.
Thank you.
Thank you. Thanks for being such great heroes, really. And I think the preventative piece is right. No one knows about it because you're doing a great job, to be honest. That's what I'm hearing. And so can you keep us posted on your story? Because I'll be wondering, like, when he's 3 or 4, I mean, I don't want to burden you with any additional work, but if you can, it would be really lovely to hear how he's doing.
I most definitely will.
Yeah, thank you so much. Thank you.
Thank you.
Okay, we'll move now to 13C, Mr. Fide. Did I do that wrong? Listen, I'm going to apologize to everyone on name pronunciation. Mr. Fide, thank you.
Thank you, Madam Vice Chair. Robert Fide, Division Director for Environmental Health Services, for the record. So you have my report in front of you, so I kind of wanted to highlight some of our successes. So last month we had our first food inspection boot camp, and we had the event was very successful. We had over 55 people attend, and they represented over 27 local establishments. And the food inspection boot camp, the goal of that boot camp was to allow establishment owners to kind of learn what our inspectors look for, at least the short list, right? Our inspection document is over 100 pages, but ideally we want folks to be able to look for those big risk factors, be able to inspect their facilities, and take any corrective actions that they may find in their own facility. And so that was the goal of the boot camp. It was highly successful. And then some other things to highlight. Some of our staff, they found a invasive body shop operating without a health permit. And so they're currently working with that operator to complete the permitting process and making sure that they meet all their plan review and operational requirements. And I guess another thing to highlight in our, we recently begin doing online well permitting through ACA. So this is a improvement for us. Staff have been updating their forms and guidance documents, and they've been working with the local well contractors to kind of test this form, and we've had positive feedback so far. So we're hopefully moving towards the direction of making things easier for our clientele. That's all the highlights I had that I wanted to share with the board. I'm open to any questions that you may have if you have anything about the report.
Thank you. Any questions? Thanks for the feedback piece on the boot camp. Wow, yes, Mr. Driscoll.
I do have a comment.
Sure, of course.
The partnership that we've developed with the newspaper in putting the inspection information out, I'm getting a lot of good response from my peer group that actually find themselves paying attention to it now and realizing the things that your team are finding and why it's important. So I appreciate the inspection process. I've known about it, been around it for a long time. Looking forward to actually maybe going on a field trip one of these days with a member of the team. So
That can be arranged.
keep
So
up the good work. Thank you very much.
thank you.
Thank you.
Thanks. I just wanted to, again, commend you. That boot camp, did you say there were approximately 50 attendees?
Yeah, but over 50 attendees, yes.
Was there one, I hate to do it, but was there one industry over another? I'm just really curious who attended.
It was all the local restaurant owners, so it
Yeah.
was from a variety of folks. So mostly our I think there were higher risk level facilities. So
Oh, good. Well, hopefully everybody walked away with, again, learning more and more and more and trying to do everybody's part and working together and, doing a great job. So
I was going to say we even raffled off a inspector bag essentially for them.
an
So that way
inspector bag with chocolate and goodies in it.
I was going to say they got a very nice thermometer.
Oh, a thermometer. Okay. More relevant than the chocolate. Thank you so much. I appreciate it. Okay, we'll move to item 13D. Dr., and I'm going to mispronounce it. Dow. Thank you. I had help.
Good afternoon, Vice Chair, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I have nothing to change or add. Some more recent updates and highlights. So in epidemiology for outbreaks, the month of February has seen another increase compared to January in outbreak increases, with 27 outbreaks declared that month alone, of which 75% were respiratory illness, and majority of these were in schools and childcare. Currently in March, we have seen outbreak declared numbers drop down with spring break and school closing, so that's fortunate for us. In general respiratory illness surveillance, influenza-like illness activities have been decreasing, but seeing higher activities in this time of the season compared to previous seasons still. Flu A remains the dominant sublineage from our sequencing in Washoe County, and respiratory syncytial virus has also been decreasing, passing the peak that we've seen in week 5, which correlates to early February. COVID cases and hospitalizations remain low at this point. In the world of measles, as of March 21st, 2025, in all of U.S. in general, a total of 378 confirmed cases have been reported by 17 states since the start of the new year. Majority of these cases are in the younger population. 95% of total cases confirmed so far are unvaccinated or of unknown vaccination status. Of the 378 cases, 17% were hospitalized, with most of these hospitalizations occurring among children under 5 years of age. So at this time, there has been no cases of measles reported in Washoe County. The last measles case in our county has been reported and investigated in 2018, which was the first in nearly 2 decades, actually. The case was imported from out of state by a male who came into contact with the case at an event, and no further transmission occurred in Washoe County. So on March 7th of NMPH did publish an EPI News from a CDC health alert information about the expanding measles outbreak in Texas and New Mexico, and included guidance for travel as well. Another EPI News on measles will be published for general guidance and awareness from our epidemiology program coming out tomorrow, and will be distributed via our listserv. So be on the outlook for that. That's all my update. I'm happy to answer any questions.
Thank you. Any questions? I do want to say that you all did a great job in terms of being really, really trying to get in front of the outbreaks at the school. And all the messaging that you did was really appreciated. So just want to thank you.
Thank you, and that's a lot of kudos to our epidemiology team working on that.
They did a great job. It was definitely noticed. I kept on hoping that I didn't see another one, and so it did kind of stop, so that's kind of good. But to your point, maybe spring break, I don't know. Anyway, thank you so much.
Thank you.
Okay. We'll move now to 13E, Office of the District Health Officer Report. Dr. Kinsley.
Thank you very much. You have my report for you. I do have some more immediate updates just to touch on, just for awareness of the board, both at a national and state level. First, as the board had been advised, but it has been in media that we did receive various cuts to both our epidemiology as well as our immunization grants. Now, these were tied to COVID, but they are broad in the sense, and so we had, as with any grant, we had budgeted conservatively with it, and so we were able to, we will not have any of our full-time staff that will need to be laid off. And so how we strategically had positioned these grants was to lower our local funds to offset that, so be able to provide that in so many instances, such as our nighttime security guards for our after-hour clinics, but as well, we had to cancel our advertisements for upcoming back to school. Usually we start at this time in spring, so we can capture students in school to be able to provide next year's vaccinations. We are going to look to see if we can continue that, but we will have challenges and we will not be able to advertise that. We had to immediately cease all expenditures on those processes. And then as well as our epidemiological standing and be able to respond appropriately and where we need to with any type of contracted staff. So we are increasing the scope of our epidemiologists and their response. So with limited resources. Now at the state, they did have to release 19 contracted staff for those services in the Department of Public and Behavioral Health. Carson City, as I previously mentioned, I'm the Executive Director of Nevada Association of Local Health Officers. So I've been working closely with our partners here in Nevada and the impact that it has over Nevada, and as well as our national standing, and was on a call with over 40 plus states today and referencing where we stand, and very similar on these points in other states. What the effects will these? We have short-term and long-term effects with these, but looking at Central Nevada Health District, they're working diligently to sue. This will impact them, but looking to how best they can manage, as well as Carson City. Southern Nevada Health District, due to its size of it, is significantly more impact, and they're working towards that, especially on the epidemiological side. As we see in the media, this is, it's an ongoing process and across our nation, but there were announcements nationally today from the federal government. So CDC will be receiving. There are cuts to all the FDA, 3,400 full-time employees. CDC about 18%, 2,400 employees. The NIH about 1,200 full-time employees, and CMS 300 full-time employees. That will be staff reductions. But what we're seeing is that CDC and the American Administration of Strategic Preparedness Response will most likely be joining CDC. And then they have created, as of today, the Administration for Healthy America, so AHA. And that will be combining the Office of the Assistant Secretary for Health, Health Resources and Service Administration, Substance Abuse and Mental Health Service Administration, Agency to Toxic Substances and Disease Registry, and National Institute for Occupational Safety and Health. So the AHA will focus on areas including primary care, maternal and child health, mental health, environmental health, HIV/AIDS, and workforce development. So that was announced this morning. We're optimistic and hopeful that this is the correct path and change, and we'll be following our federal partners as well as our state addressing this. As from federal down to even our local, we're facing these budgetary things, but we continue to plan well. We have amazing staff, administrative, and as we work to this, but always our priority is to guarantee the safety and public health of our community. As this evolves, I'll continue to update the board, but working diligently on those points and working with our partners, both nationally and local, to address these issues. And looking forward to the cooperation and that we have with our community and our stakeholders. Other than that, any questions for my report?
Does anybody have any questions? Mr. Anderson, do you have any questions?
No, ma'am. Thank you.
Thank you, Dr. Kinsley, and thanks for, staying on all of it. And really, thank you so much for pivoting. I think, I almost don't want to use that word because it's a little overused, but I think it's appropriate. Everyone's pivoting. That's what it feels like.
Yeah.
And so I used to play basketball, and I wasn't very good at pivoting, but when it comes to this, it's almost always being forward thinking and what you might have to consider. And so I think that there may be opportunities too that maybe will reveal themselves. I think the timing of even the assessment pieces that we just is actually, no one knew that all of what's happening would be happening. At least I don't think anyone knew about it, but the fact is that when you even have these assessments and these third parties come in, they may have opportunities to actually implement things that maybe can look at some efficiencies, and hopefully that will help. But thanks to you and to all the staff for, working through all of this. So hearing no questions for Dr. Kinsley, we'll move now to item 14, which is public comment. Do we have any public comment?
I have no requests online or in person for public comment.
Okay, hearing no public comment, we'll move to item 15. Do any of the board members have any comments or announcements or any requests for future items? Mr. Driscoll.
Thank you, Madam Vice Chair. I'm just letting the chair know and the health officer, I will not be in attendance for the April meeting, and I will not be in a position to where I can communicate in. So I will just be absent, and I'll just catch up by reading the minutes from that standpoint.
Thank you. You know what happens when you don't come, right?
I recognize
You've been around a long time, my friend. That's right. You are very experienced, my friend. So when you come back in May, we might have a big surprise for you. You said you want to go on a tour. We might put you as an inspector to help with the budget. Teasing. I'm teasing. Do you have anything, Mr. Anderson? Do you have anything?
No, ma'am.
Well, hearing that there isn't anything, I'll go ahead and adjourn the meeting. Thank you, everybody. Thank you so much for a great meeting. Meeting is adjourned at 3:11.
Thank you.
Thank you.